This was one of the most fascinating town halls I've seen by the president and the people. Smart questions, some of them critical of the president, but none of the tempers or shouting that we have seen at healthcare forums in other parts of the country. I'm joined right now by three people who were in the audience at today's town hall. One is Chad Middleton. He's an assistant professor at the Mesa State College. He supports the president's reform plans. Bill Huggenberg is a retired attorney, and he's more on the fence about it. He's not sure. He says he likes some of the president's ideas on health care, but not all of them. And then there's Debbie Shum. She's a small business owner. She's against the president's plan to reform America's health care system. Thank you so much for joining us. Hey, listen, I want to talk to, let's start with Debbie real quick. Debbie, what is your position in regards to the president's health care forum and the plans today? Did you see anything about it that you liked in all of this?
No, I did not. As a libertarian, first of all and foremost, I'm opposed to the government intervention in it to begin with. One of the things that I find particularly offensive about this is I don't have insurance and I don't want insurance. There's no provision for me or people like me in this plan.
You don't want health care insurance?
This is a mandatory insurance plan.
You don't want health care insurance at all?
I would like to have some insurance if it were affordable. In my opinion, it's insurance that has caused the problems in healthcare to begin with. And when we have a mandatory insurance program, this is basically a corporate welfare subsidy for insurance companies.
Yeah, you know, I hear you, Debbie. I'm not exactly sure if what you're saying about this is accurate, because a lot of people need health care insurance in this country, and just because you don't want it, it doesn't mean that the millions and millions of people who are uninsured and need it, that they don't want it as well. I'm going to move on, and I'm going to let you think about that. I'm going to go now to Chad. Chad, you said you support the president's reform plans, and if no one has proposed health care reform before, not even the former president has proposed that, or at least has taken up this issue. The Clintons did before that. So if the government doesn't come in and work on health care reform, then who's going to do it?
Yeah, it's a very good point. I mean, I do believe that the healthcare system is broken, and something needs to be done. I mean, the inflation rate is increasing at a greater rate with insurance premiums over wages, and if something's not done, like the president said today, I mean, I do believe we will be going into the red, and I do believe doing something is the answer. Doing something. As far as what the details are of these plans, yeah, I think something needs to be done.
Okay. Look, hey, Bill, did you get anything specific that might have changed your point of view today, because you said that you're on the fence about it? Anything that the president said that won you over or pushed you back on the other side?
The president did not have to win me over. I'm fully supportive.
You're fully supportive. You're not on the fence.
Well, I'm on the fence about specific details that haven't been identified yet.
Okay.
As a result, I kind of agree with both Chad and Debbie that there are issues that need to be addressed that go beyond the generalities we heard today.
Yeah. Hey, listen, we're having problems with your satellite, but hang on, guys. I think this is, you know, we can deal with it. It's live television. It's a satellite fade, so not a big deal. Let's continue to listen to these people, and if the satellite goes out, we'll move on. So, Debbie, did you have time to think about what I said? I mean, just because you don't want reform, it doesn't mean that people around the country don't want it and don't need it. Do you think that's a selfish approach or a selfish attitude towards this?
I never said that I don't want reform, but my opinion, I think that the system is broken as well. But the approach that is being taken is not reform. It is corporate welfare subsidies for the insurance companies. How does that benefit anybody? How does that benefit me as a patient? How does it benefit my doctor? That only benefits insurance companies. And if we're to say, okay, well, then we have the public option. Well, as a small business owner, I have many customers all over the world. And my customers in England, who also have a mandatory insurance program there, have informed me that their national tax rate is 78%. Yeah. I don't believe the president when he says that this isn't going to cost any more money.
Okay. Well, Debbie, we really appreciate you joining us. Bill as well. and also, who do we have here? Debbie, Bill, and Chad. Chad, thank you very much for joining us. We had some problems with the satellite there. We're very sorry about that. Hope it wasn't distracting, but I think you all had very good points, and we appreciate you tonight, okay?
Thank you.
All right,
Thank
thanks
you.
very much. Opponents of the